You are welcome to the health part. Today, I'd like us to discuss birth preparedness and complication readiness plan. Now, why birth preparedness and complication readiness plan? Pregnancy itself is a journey from 0 month to 9 months, maximum 10 months. Now, take it like you are having plans of traveling to your hometown. Definitely, you place things in order. When I say placing or putting things in order, you make sure that you have your luggage, your clothing, your shoe, whatever you need towards that journey. You make sure that you place them down. The same goes for pregnancy. That is why when you get pregnant, unfortunately, you are able to conceive and you visit your midwife or your specialist or obstetrician gynecologist, you need to ask him for a layette or a list. This layette or list contains items that you will need for your labor. Now, when it comes to birth preparedness and complication readiness plan, we always don't pray that a pregnant woman will end up with complications. But when you plan ahead, it helps to reduce certain uncertainties when it comes to emergencies. Why? Most of the times, these maternal deaths are deaths that can be prevented, but due to certain things which were not kept right or things that were not put in place properly, it ends up being bad. Now, when we say emergency always deals with timing. And to save one's life is all about timing. So why wait for the uncertain to happen? Why wait as a pregnant woman for you to start bleeding in labor or even at theater to start bleeding before people will be running helter-skelter to get blood for you? I hope we are all getting what I'm trying to say, or we are all picturing exactly what I'm trying to put across. Now, when in birth preparedness and complication readiness plan, let's look at what goes into it. Aside the list of items for mother and baby, let me mention a few. We have the baby clothing, the socks, the mittens, baby's hat, baby diaper, and also when it comes to the mother, we can talk about the nightie, the cap or the mesh thing they wear around their heads for protection, to protect their hair, to make them look organized and neat. And also we can also talk about their sanitary pad. Then the sanitary pad, mostly we prefer the one which is purely cotton, because we're going to deal with blood. It helps us to measure accurate blood loss. Then the mothers too, we can also talk about the Macintosh, which they will need, and also obviously the delivery mat as well. And if some old clothes. When I mean old clothes, I don't mean old, dirty and tattered clothes, but clothes that are old, which you may not use, you do not use it. You may not use it now, but you can use it purposely for delivery. Then we have old graphic paper. Old graphic paper is to help to wrap up this used pad nicely and dump it into a safety bin or a yellow bin, which is safe. Now, let's talk about finances. Now, money is not easy to come by. That is why, as a pregnant woman, when you come for antenatal and you don't have health insurance, your midwife always advocates that you try and go to the National Health Insurance Office to get one. It is all part of complication readiness plan. Yes, it's all part of birth preparedness and complication readiness plan. The NHIS will subsidize some of your costs for you. Exactly. Or you may not even pay anything at all. All right. Now, let's talk about blood donation. Most of the times, midwives encourage pregnant women to donate at least 4 units of whole blood. Not necessarily the pregnant woman, no. It's not the pregnant woman who is going to donate the blood, but she's supposed to get at least 4 people, either from her church, from her community, among her friends, to organize to help donate blood and then secure that blood in a blood bank, so that in case of an emergency, there is blood secured for her. Are we together? I hope we are clear here. Yes, in case of an emergency, that blood can be used for her. So that is why we always ask that the pregnant woman should get at least 4 people to donate 2 units of whole blood for her. It's all part of complication readiness plan. Now, the question is that we mostly get is, if the blood is not used for me, what happens? Always, what I tell my clients is, we should always be grateful to God that the blood was not actually used for you, and that you went home healthy, alive, and happy with your what? Newborn baby. But the blood is just kept there in case there is an emergency. But if I should go in labor, or if I should go through a cesarean birth, and by God's grace, thankfully and hopefully the blood wasn't used for me, I don't think I will be angry why the blood wasn't used for me, because the issue here is with what? Complication readiness plan. Complication readiness plan. My clients, my pregnant women, kindly let's take notes. They are all part of plans to what? Reduce complications, or to make sure that in case of anything like that, which we don't pray for, anything like that should happen, we can come in. Now, what other plans or measures should we put in place? You have to think of the driver who will be bringing you in case of an emergency. Other pregnant women will tell you that they have a car, so they will drive. But mind you, when labor sets in, at that time you may not even remember where your car keys are. So why don't you arrange with a driver, someone whom you know? It can be a neighbor, it can be a taxi driver, a trusted person. Then in case of labor, or in case labor sets in, these people can what? Carry you to the health facility to deliver safely. Okay? Then other people too will think of organizing with motor riders. Though sometimes it's not advisable, but unfortunately in Africa, we have people who are living in areas who don't get access to certain means of transportation, and their main means of transportation is the motorbike. Okay, so that is why sometimes you need to sort to these people, unfortunately. Now, let's come to our pregnant women whose time is almost due. Now, bear in mind that your first scan that you take will show you something we call the expected date of delivery. Then the last scan to a time, you notice that the expected date of delivery may alter a bit, or it will change. So it is either +2 or -2. Now, the word here is estimation, is an estimated date. So the best thing is that as you move in the market, or as you go to your office, your time is almost due, make sure that you carry one items with you. Maybe one sanitary pad, one delivery mat, one baby dress, one diaper, just something small, and put it in your handbag. You may not know where or when labor might set in, where they will need to take you to a facility which may not even be where you attend antenatal. Then those items can be used immediately for you before we call your relatives to bring the rest of your items. Take note, my clients, is very, very necessary. I don't want a situation whereby you go to the hospital where you don't have anything, and then you'll be mistreated or malhandled by people, or people will talk to you anyhow. No, 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 no. Please, try this and let's see. You notice that all these things will prevent all these unnecessary commotions and talks, which brings anger and all those things at the facility. My clients, with all due respect. Now, let's think of the one that you'll be leaving home as you go for labor, the one who'll be taking care of your kids at home. That is, if you have kids already. Definitely, when you're in your absence, there should be someone there, like your mother, your sister-in-law, a church member, a pastor's wife, even anybody who will be there to support whilst you are away. Let's think about that. So please, all these are parts of birth preparedness and complication readiness plan. If there are any questions which might be bothering you, or any other thing that you would like to add for me to clarify, kindly put it in the comment section and I'll attend to you immediately. Thank you very much and have a nice day. Bye.